Thank you for your interest in the Tiger study, an NIHR-funded study led by the University of Bristol. This video will cover the background to the study, its design, and what involvement means for your GP surgery. We are happy to follow this up by email with a meeting to answer any questions you have at the end of it. Before we start, we should remind ourselves of the importance of good clinical practice, or GCP. GCP is an international and scientific quality standard for the design, conduct, monitoring, analyses, and reporting of clinical trials. This trial is being conducted in accordance with GCP to ensure that research participants are not exposed to undue risk and that data generated from the research are valid and accurate. Eczema is common in children, and parents often ask their doctor whether a test might uncover a food allergy as a cause for the child's symptoms. If parents' concerns are not taken seriously, they may be reluctant to use prescribed creams, which they treat the symptoms and not the cause of the child's eczema. Specialists vary in their use of blood-specific IgE or skin prick tests, and there's a need for research to determine what role, if any, routine food allergy testing has in the management of childhood eczema. Tiger is a randomized controlled trial designed to answer the research question, does test-guided dietary advice improve disease control in children with eczema? We need the help of around 84 GP surgeries to recruit 493 children with eczema. For a typical list size of 10,000 patients, this means around 6 participants per practice. The eligibility criteria are listed on this slide, the main ones being aged between 3 months and 2 years of age with at least mild eczema and no previous food allergy tests or diagnoses for the 4 study foods. Participants will be randomized to standard care or dietary advice based on the results of skin prick tests to the 4 study foods. The primary outcome is a patient-reported measure of eczema control called RECAP. A range of secondary outcomes includes eczema symptoms, signs, and quality of life. Parents also have the option of letting us collect a saliva sample for DNA analysis for genes associated with eczema and food allergy. Everyone is followed up for 9 months. In addition to the trial, there are nested process and health economic evaluations looking at the implementation and cost effectiveness of this intervention respectively. Over this and the next slide, I will talk through participant recruitment and follow-up and where your surgery fits in as indicated by the stethoscope symbol. First, you will run an electronic medical search for potentially eligible children. We estimate in an average practice this will generate a list of 25 to 50 children to briefly screen for suitability. We then send an invitation letter followed by a text reminder to the parents or guardian of that child. We will send you further instructions on how to do all of this. We will ask you to repeat this in a few months' time to capture any new children with eczema. In addition, you can opportunistically signpost parents of potentially eligible children to self-refer into the study. Interested parents will be contacted by the research team who will receive consent, collect pre-baseline data, and arrange the baseline visit. The baseline visit will take place at a GP surgery. This will be either at your or a neighbouring participating GP surgeries. We will also ask if you're willing to host the baseline visits for patients from other nearby GP surgeries. In addition to a clinical room for the baseline visits, we also need medical cover in the unlikely event of a reaction to the skin prick testing. Serious reactions are uncommon, of the order of 1 in 10,000, so similar to a childhood vaccination clinic. The baseline appointment itself will be delivered by a study research nurse unless your surgery has identified someone to do it, in which case we will train them up. Any practice-based clinicians delivering the intervention will still be accompanied by a research nurse to undertake the research-specific activities. If a participant is randomized to the intervention group, they will have skin prick tests to cow's milk, hen's egg, wheat and soy, and will be given dietary advice according to the findings. For safety, some children will be referred by the research team to have an oral food challenge as a day case at their local allergy centre. All follow-up over 9 months is done by the research team, mostly by means of questionnaires, with a face-to-face assessment, usually in the participants' homes, at 24 weeks. Care of all participants is otherwise unchanged, including referrals to secondary care if appropriate. The risks to anyone taking part in this study are low. This slide gives the definition of the adverse events and reactions as listed in the protocol. Site teams are responsible for identifying adverse events for their participants during trial-related appointments, and any other appointments or admissions, as reported by participants and/or healthcare colleagues. This slide is a reproduction of the flowchart in the protocol and what action needs to be taken according to what type of safety event has occurred. Please refer to it if needed, but if you're unsure about the significance of any event in a study participant and whether to report it or how to record it, contact us and we'll be able to advise you. Payment follows research activity as detailed on the research information sheet and this slide. In order to give your practice the green light and begin the search, screen and mail out task, please complete your contract and delegation log as soon as possible. The trial is paperless with all study paperwork, including the current version of the study protocol, accessible via the study website. Thank you for listening to this presentation. Please contact us by email with any questions or to arrange a follow-up meeting to get you started.